15 million people suffer from some form of autoimmune, right? 4.6 of that is roughly US population. And of that, 63% are female. So females make up the majority of autoimmune conditions. So ulcerative colitis, Crohn's, those types of things, really, really harrowing, obviously, for women to deal with because of what happens to the body when you're going through that. Background-wise, obviously, you were an aesthetic patient, and then I don't even know what happened. Like, you had a really, how long have you had, when were you diagnosed with ulcerative colitis?
I was diagnosed in 2012.
Okay.
And I took mesalamine, which is like anti-inflammatory that I guess targets the GI.
Yep.
I took that and I did like suppositories for a few months, and then I cleaned up my diet. I had no idea about diet back then. I started working out, I got into CrossFit and started eating real food.
Right.
And I was off medication for over 10 years. So I didn't have any issues.
When you came as an aesthetic patient, it was completely in remission. Like, there was nothing.
Mm-mm.
And then kind of fast forward, I was doing my fellowship and really starting to kind of pivot because of my passions changing with anti-aging and what I went through personally with menopause. And you relapsed, and that was when you reached out and you were like, because you were, I remember we were standing in the office and I said to you, I'm like, how are you functioning? How are you walking? Because I looked at your hemoglobin and I almost fell over.
I wasn't.
You ready?
I had to.
Yeah, you were like it was 8.9. I was like, how are you breathing and walking? Do you remember? We were just like, I was dumbfounded. And we kind of went through, so talk to me a little bit, like, so you have this relapse, and for people that don't understand ulcerative colitis, chronic inflammation of the large intestine, bleeding profusely, massive blood loss through the bowels. In really acute cases, we would see patients admitted via the ER. They'd get transfused. I mean, it's a whole process because the amount of blood loss that happens. And so you had this relapse, and kind of talk me through that if you can.
Sure. So I was working full time. I had a 1-year-old, a 4-year-old at the time, 4-year-old, and I was functioning because I had to.
Yeah.
I don't know how I was walking. I was exhausted, I was tired all the time. I was at like month 10 of breastfeeding my 1-year-old, and I relapsed. It just kind of came up out of the blue. I don't know if it was like stress induced from being back to work and having 2 kids, and just, I don't know. Doctors have always told me it's stress related, or you can manage it through stress. So I assume, I don't know what caused it to come back, but it came back with a vengeance. It was worse than it had ever been. I couldn't function. I couldn't get out. Like, it took everything in me to get out of bed every morning. And I kept watching your stories on Instagram about peptides, and I saw one about anti-inflammatory, and I had reached out to multiple GI doctors, and all they wanted to do was get me scheduled for a colonoscopy and get me on prednisone in the meantime. I didn't want to take prednisone. I didn't want to take biologics, which is what every GI doctor has ever pushed on me. And
yeah, because those are the clinical guidelines, essentially, in management of it.
Yeah. So
and it's when
and
you
it was
don't
a super high dose of prednisone.
Yeah.
It was like 40 milligrams a day for 6 weeks
Yeah.
or 8 weeks, and
they don't tell you what happens to your bone.
So many side effects.
Yeah, they don't tell you about potential for ulcer or what happens to your bone. There's so many components. And listen, we even talk about that in aesthetics. You have so many providers, a patient complains of a little bit of swelling and they want to throw steroids at them. So, and a lot of us are over here like, no, don't do that. Because obviously they're a useful drug in certain circumstances, but if you can treat, because what we did collectively, kind of, I call it as a team, because I admit I was like calling and texting you a lot, obviously, because I was worried, because we were, that's the other problem too in what I call mainstream medicine, is we practice very defensively in many respects, because what's every provider's worst fear, right? It's litigation.
Right.
As married to paralysis by analysis over there. So we practice that way. So the peptides are not a part of clinical guidelines because they're not a part of mainstream medicine,
Right.
you know? So you are really having to come outside of a box. Like I was trained at a great institute, you know, USF is a great school, a great med program, everything, but you're trained to follow these clinical guidelines. So we did the exact opposite of those with you. Because I have a very close personal family friend who's a phenomenal GI specialist, and I had many conversations with him about it because he didn't really know about peptides, and he's still so intrigued by the fact that we have you in remission through this, you know, this protocol. And a lot of what you did though too, we talked about the carnivore diet and the different things that because you were your own advocate too in many respects. But anyway, I didn't mean to interrupt. So you had like saw stories and we're dealing with obviously, like, I think we talked at one point like 18 to 20 times you're having to go to the bathroom.
I was up to 30 times a day at one point. By the time I saw you, I was down to 18 to 20, and that was just through diet alone, just trying to manage inflammation by what I'm putting in my body. I'm like,
and they had already scoped you by that point too, right? He had done the colonoscopy on you?
I got scoped in August. So
Okay.
I relapsed in May. I couldn't get in for a colonoscopy until August. So they wouldn't treat me. They wouldn't do anything. They were like, you can take prednisone. It sounds like that could help. I was like, well, no, I don't want that. So I got scoped in August. They confirmed it was ulcerative colitis, which I could have told them.
Yeah, you knew.
That's what it was.
Yeah.
And not that I'm anti-medicine, I just don't like to take medicine. I want to heal. That's my goal. And I was like, I don't want to just take something and mask my symptoms and
wait for it to come back again.
And be fine for a few weeks, a few months. And I want to heal this inflammation. I want to heal these ulcers. I want to stop bleeding.
Yeah.
I just wanted to feel normal.
Again. And that's the other part of it too, because obviously young kids, you and your spouse being active, you want to enjoy the things in life that you've always enjoyed, and it changes the trajectory of everything that you're doing because you have to plan. You know, everybody sees the commercials, mostly they're for, from Big Pharma for biologics, but it's with ulcerative colitis and planning trips around the bathroom, but that's literally what happens to people.
My whole life revolved around.
Yeah. And the other part of it with UC, and I've talked about this a lot too, for most disease processes over the age of 45, and you're not there yet, God bless you, but most disease processes over the age of 45 are inflammatory driven, right? They're from inflammation. And that inflammatory process in the large intestine, we have worry about, we worry about cancer development. So with your peptides, we threw literally everything at you. I had you on TA1, we were doing TB500, you have low dose naltrexone, glutides, which is the oral combination of BPC and KPV. We did lorazepam to heal those junctions within the gut.
1 round of PDA.
A little bit of NAD, which I think the cellular activity of that, I think that was a little bit potent for you because you were still healing. But it's, I always, when I talk about TA1 alone and how incredible that is, we make that when we're young. And as we age, we're not in production of those same type of things that we were making when we were young. And it's such an incredible immune modulator, right, for healing and supporting our immune system. And I think Joe Rogan put it on the map when he was talking about TA1 on one of his podcasts, I think a couple years ago now, but it's underutilized, But the part that's frustrating as a clinician is we know that it's never going to gain traction because there's never going to be big money behind it for big pharmaceutical companies. But it modulated. I've joked. I was kind of chastising my husband the other day because he had forgotten to take out, we have like a morning routine and we're on a certain cycle right now. And, it set me back like $2,500. It's not cheap, And I'm like, thank God we only cycle these a couple times a year. But I also am of this mindset, like at what cost for our health,
right?
Because a colonoscopy is a couple grand if you don't have great insurance. And even with insurance, if it's not for a screening, you're still paying more out of pocket.
I'm too young for...
You're not in that category for screening. And then biologics are incredibly expensive. And that part alone, with biologics, you're looking at such immune suppression. So what are you going to develop down the road
Right.
because you've been on those biologics, you know? So I think your story is so incredible just from the standpoint of you've continued, even through all of it, when you were really when I was like, oh my gosh, you should be getting transfused. I was so worried, you know, with where your levels were. But holy moly.
Ignorance is bliss, because I didn't know.
But I did look at you and I was like, how are you breathing, you know? Because your hemoglobin is that oxygen transport, you know, and then your hematocrit was really low too. So I'm like, you are clearly losing a lot of blood volume. But even like looking through, when I was doing like a little analysis and looking at your inflammatory markers and things trending down and albumin, it is truly like the cover story in so many respects for what peptides do for our body, you know? So obviously grateful for your faith in that journey, and for what I like to call my micromanaging, because I would be texting you, Kristen.
No, you changed my life. So
that's
I wasn't
music
living.
to my ear.
I was just here.
Yeah.
So.
Do you feel like when you look at this in its like totality, do you believe in? I mean, do you feel like you're a true believer in the power of peptides now?
I'm sold. Like I said, it changed my life. To think that was only 8 months ago, like I couldn't get out of bed 8 months ago. Like I could barely get ready in the morning. I was dragging at work, and now I have energy. I'm working out. I'm lifting weights. I'm going to work. I'm happy. I'm
feeling more
It's
balanced.
not just like healed me, but it's like given me life and energy